Ever wondered about those cute, spontaneous movements your baby makes? These are known as baby reflexes. Yes, those adorable little jerks, twitches, and seemingly random responses are actually an essential part of your baby's neurological development. These reflexes are involuntary, automatic responses to specific stimuli. They offer us a peek into the fascinating world of infant development and well-being. They tell us about the integrity of their nervous system and how well it's maturing. With each little startle, grasp, or rooting movement, your baby is demonstrating a complex network of neural pathways and connections that are hard at work. It's like a symphony of signals, each playing an important part in your baby's journey of growth and discovery. So, while they may seem random and adorable, these reflexes are a serious business in the world of pediatrics. Now that we've briefly touched upon what baby reflexes are, let's dive in and understand the different types of baby reflexes. First on our list is the Moro reflex, also known as the startle reflex. This reflex is one of the earliest and most easily observable in newborns. It's triggered when a baby experiences a sudden change in position or a loud noise. The baby's typical response is to extend their arms and legs outward, arch their back, and then draw their limbs back toward their body, almost as if hugging themselves. This reflex is more than just a cute baby quirk, though. It's a critical indicator of the health and integrity of the baby's nervous system. The presence and intensity of the Moro reflex can give healthcare providers valuable insights into how well a baby's nervous system is developing and functioning. So, while it might seem like just a startle response, the Moro reflex is actually a baby's first line of communication with the world around them. The Moro reflex, hence, is a baby's first response to the world around them. Feeding time with your baby? Two reflexes come into play here, the rooting and sucking reflexes. Let's dive into these fascinating responses. The rooting reflex is typically observed when you gently stroke a baby's cheek. This touch triggers an instinctive turn of their head towards the stimulus. The baby's mouth will also open in anticipation. This reflex is nature's ingenious way of making sure a hungry baby can find their food source, be it a breast or a bottle. You'll notice this reflex most prominently in the first few months of life, becoming a voluntary action as your baby matures. Now, once the baby has located their food source, the sucking reflex kicks in. This reflex is activated when the roof of the baby's mouth is touched. The baby will instinctively begin to suck, allowing them to draw milk for their nutrition. This reflex is not just for feeding, though. You may notice your baby sucking on their fingers or a pacifier, which can provide comfort and help soothe them. Together, the rooting and sucking reflexes facilitate successful feeding. They are vital for a newborn's survival, ensuring they can feed and get the nutrients they need to grow and develop. These reflexes also play a role in bonding between the baby and their caregiver. The skin-to-skin contact and eye contact made during feeding times foster a strong emotional connection. It's important to note that these reflexes may not be strong in premature babies, who often need a bit of extra help with feeding. If you notice any issues with your baby's feeding, such as difficulty latching or an inability to suck effectively, it's always a good idea to seek advice from a healthcare provider. So, the next time you're feeding your little one, remember the rooting and sucking reflexes at work. These instinctive responses are more than just cute baby behavior. They are critical skills that your baby uses to navigate their first interactions with the world. These reflexes ensure your baby's nutritional needs are met right from the start. Next, we have the grasp reflex and the stepping reflex, two fascinating reflexes that demonstrate a baby's innate abilities. First up is the grasp reflex, a compelling display of a baby's natural instinct. This reflex is triggered when an object or finger comes into contact with a baby's palm. The baby's response? They automatically wrap their tiny fingers around the object, holding on with surprising strength. This reflex is present from the moment of birth, showing an instinctive grasp that's believed to be a primitive survival instinct. As the weeks and months pass, this reflex slowly gives way to voluntary control of the hand, an important milestone in a baby's motor skill development. Now let's turn our attention to the stepping reflex, another fascinating automatic response seen in newborns. This reflex is tested by holding the baby upright with their feet touching a flat surface. What happens next might surprise you. The baby will start to make stepping movements, as if attempting to walk. This reflex may seem like a precocious attempt at a first step, but it's actually a sign of a baby's inherent ability to coordinate leg movements. This stepping reflex typically disappears after a few weeks, making way for the baby's deliberate and controlled leg movements. But remember, this reflex isn't about walking, but rather an indication of muscle coordination and neurological development. The grasp and stepping reflexes are more than just cute quirks of infancy. They're the first signs of your baby's developing motor skills. These reflexes indicate the maturation of the nervous system and the development of motor control. So, the next time you see a baby tightly gripping a finger or making stepping movements, remember it's not just an adorable sight. It's a testament to the remarkable innate abilities of a baby and a window into their neurological development. These reflexes are the first signs of your baby's developing motor skills. Lastly, let's discuss the Babinski reflex and why checking these reflexes is crucial. The Babinski reflex is observed by gently stroking the sole of the baby's foot, initiating a response where the big toe extends upward and the other toes fan out. This reflex is quite normal in infants, but if it persists beyond the child's first few years, it could indicate potential neurological issues. Now, why are these reflex checks so important? Well, these involuntary responses give us precious insight into the baby's neurological development and functioning. Absent overly pronounced or persisting longer than expected reflexes can raise concerns about the baby's nervous system or muscle tone. This could prompt further assessments and diagnostic tests to identify any underlying issues. Regular reflex checks, therefore, contribute to comprehensive care that supports the healthy growth and development of infants.